the Maria Holder Diabetes Center.
Sugary drinks spike your blood sugar faster than anything else. Water is your best friend.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry, and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
The next 15 diabetic-friendly minutes you hear on 100.7 QFM is being brought to the Q family with the compliments of the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center. Good afternoon, Q in the community and regathering peoples. It's Peter Boys here, and it's the last week for us to celebrate 59 years of Barbados independence, and also the last week for Diabetes Awareness Month. So you have to make use of this week, peoples. So if you are diabetic or pre-diabetic, this might be a good time for you to make an appointment with the Maria Holder Diabetes Center, which is located up there in Warren, St. Michael, before the Christmas rush start. Or even if you are not diabetic and you just want to check your health numbers before you start your Christmas eating, this might be a good thing to do. I ain't gotta do that for true. And if you are a BART member, that's me. We are making it even easier for you, because tomorrow, Thursday the 27th of November, will be the last for the Diabetes Foundation health checks at the BARP office in Hastings. So you went, yeah, we waiting for? So now you only got tomorrow to go. So call and make that appointment now. 417-0305. So when you put on your good clothes tomorrow before you go to Q in the community, you find yourself at the BARB office in Hastings for a Diabetes Foundation health check. Tomorrow is the last. Good. On to our first topic of the day. You know, sometimes you just be getting on a certain way and somebody just tell you, well, you don't behave yourself, though. Well, do you know that same self-management is important when it comes to your diabetes care? So we are bringing Dr. Diane Bradford from the Maria Holder Diabetes Center to talk about diabetes self-management. So try and behave yourself and listen.
Self-management education is a very, very important tool if you're at risk of diabetes or living with diabetes. And what does this mean? It means that you need to know how to manage your risk and you need to know how to manage your diabetes. You need to know if you're on medication, what medication you're taking, what it does, how it works, its name, when is the optimum time to take it, is it taken relative to food or not, or does it not matter? You also need to know how to cope with stress. You also need to know, am I getting enough sleep? And if you're not getting enough sleep, what tools can you put in place to enhance your sleep? Some people may not recognize how sleep deprivation or interfered sleep actually does two things. It increases your risk of diabetes, but it also can cause a decline in your diabetes control. And why is this? This is because it upsets some of your natural hormones that are involved in carbohydrate metabolism and other pathways related to glucose control. We want you to be informed about the reality of diabetes and not living in a world full of myths. You need the facts, not myths. Don't mention that big word nutrition. For many people, a personalized nutrition plan will work best simply because it's something that takes into consideration your preferences, your eating habits, your eating patterns, your lifestyle, and also other coexisting medical conditions that you may have. If you have never had dietary advice or self-management education, please ensure that you get this done. It is in fact recommended that you have both of these done at the time of diagnosis every year. Yes, believe it or not, every year. And when something changes in life, or if your life circumstance changes, you have a new diagnosis of another chronic condition or anything that changes how you live with your life, because you may need to put different tools into place to help you cope better with living with diabetes. Please ensure you have a physical activity plan. Most people really should be exercising almost every day that you exist. It makes sense. We're human beings, we're living, breathing creatures. Exercise is good, it's necessary. For children, we recommend at least, and that is a minimum of 1 hour physical activity every day. So do encourage your children to get out there and be active, obviously in safe spaces and environments. And if you're an adult, a minimum of 150 minutes a week spread throughout the week. This can go to as much as 300 minutes a week, but you should also be having some strength training at least 2 days of the week. Remember, as we get older, we lose both muscle mass, strength, and bone strength as well. So exercise actually helps to maintain these things. Don't forget your feet. Protect your feet. Those are your 2 blessings that will take you through life. Just as your eyes are important, remember to have your eyes checked regularly. So check your feet every day. Make sure you know how often you're supposed to get your eyes checked. Make sure that you wear foot care that doesn't injure your foot, obviously, or increase the risk of injury. Make sure you're screening regularly for the complications of diabetes, such as nerve damage, artery circulation issues, your kidney function. Having a check on the liver function will be part of your annual medical, and there is just so much more.
Thank you, Dr. D, for that good diabetes health information on 100.7 QFM as we go into our Q Song of the Day. Our last week celebrating 59 years of independence and Diabetes Awareness Month. And of course, our song is from a Bajan star, Edwin Yearwood, with Doing This Again. Compliments the Maria Holder Diabetes Center.
Holder Diabetes Center.
Every time it comes around, we'll have a ball. That's why I'm doing this again. Proving this again. Doing this again. Proving this again. Doing this again. Singing out happy birthday to my life.
Self-management education is a very, very important tool if you're at risk of diabetes or living with diabetes.
Happy birthday.
Diabetes Center. A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
As we continue on QFM for Diabetes Awareness Month, we go to diabetes nurse with the Maria Holder Diabetes Center, Miss Tracy Bushell, to tell us what she sees as the state of diabetes in Barbados.
A lot of the referrals that we get, it's actually quite amazing how little they understand and education that they may have received in the past. So when they come to see us, and my role is key, is education. That's my bread and and butter every day, as well as just reviewing patients, managing medication and everything. So it's actually all the disciplines that we have. Our whole management system is about creating self-management skills for these clients to help prevent all the long-term complications that are associated with diabetes. So they would go around all the disciplines during their 6-month program. Hopefully at the end of it, they will have the tools, the information that they need to be able to continue forward and live a very healthy life and be able to manage their diabetes well. I think one of the things that actually did cause me very much concern when I first came to Barbados over 12 years ago was the amount of problems that we have with, people have at-risk foot and foot ulcers. And, we see many of those patients come through the diabetes centre. And it's not just about their wound care, because it's the whole multidisciplinary team, that continue to educate those patients to help make sure that it's not just about their foot ulcer, it's about keeping their diabetes well controlled as well.
Hi, my name is Sean Payne. I'm dealing with type 2 diabetes. I've been suffering with diabetes for over 25 years. I first been diagnosed when I was about 30. Medicals and everything, I go to Diabetic Foundation to get better treatment, better care, and more focus on my diabetes and bring it down to a level. The staff here is actually doing a pretty good job, and they are very committed to this work and professional. They also welcome you here with a whole set of tests, a whole set of body tests that you will usually get at a private doctor. I was in a situation where I was losing both of my 2 feet, and I had to come here for better attention to the situation that's going on with my feet, to adjust my medications, put me on a special diet, everything. And right now, my body's coping with it very, very well, and I would suggest that anybody with diabetes come to the Diabetes Foundation, get checked out, diagnosed everything, and get on the routine for better health. One of the biggest challenges in diabetes is diet, and the cost of living in Barbados and everything that is actually good for diabetes and to use for diabetes, very expensive. Medication-wise, well, if you don't know, the medical service is free. You got to come here, get assessed everything, and get what is your right medication for you. Next challenges we also have as diabetics in Barbados, there's a stigma that going around if you are disabled or anything with diabetes. People tend not to recognize it, but people, if I tell you you're a diabetic, some people don't want to hire you, you don't get no work, certain things just shut down in your life like that. One of the hardest challenges is food stuff and eating properly, because it has a lot to do with diet. I've not fully conquered my eating habits. I changed, and certain things I don't eat anymore, like a lot of starches and stuff. I cut out all those things on my diet. So just be like veg and greens, and I eat my protein is meat. That's it. We in Barbados have a problem with eating, and our eating habits are terrible. That's the first thing. We tend to eat a lot of fried foods, a lot of unhealthy foods, which contribute to diabetes and leading on to all kinds of multiple diseases. We use less greens in Barbados than anybody else in the world, which I get to realize when traveling. We need to have a balanced, proper diet. They use more vegetables and greens in our diets so that our food will digest much faster in our body and pass through our body instead of sticking it and turning it to sugar and starch. I have osteomyelitis in my foot, like a bone disease actually that's trying to eat at the bones of my feet. I've been getting medication for it, keeping my blood sugars low just to help control it. So we heal right now. 2 amputees and still walking. I think it's best for you to get around. Do not coop up in the house. Get active, get moving. The same things you would do when you were not sick, try to continue doing them and keep yourself active. Because if you ever tell yourself you're going to sit, you're not going to get better. You're going to be in pain. So you're going to keep your body moving, do some community activities, go out, play a little road tennis, try a little something, Involve yourself in little fun walks and activities and stuff, and keep yourself active.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
Diabetes doubles your risk of heart disease. Know your numbers today.
The Maria Holder Diabetes Center,